afternoon to all of you. I'm Salwa Rafee, VP of Global Development with H-ISAC. Welcome to our session today. We're going to talk about the current trends of healthcare security, medical tourism, and impact on patient privacy and safety. But first, let me introduce who we are. H-ISAC is a global member-based organization working with the health sector to share security, threat, and vulnerability information specially curated for the industry. Our mission is to enable a trusted community in global healthcare and life sciences by being proactive to prevent cyber attacks, detect malware accurately, and manage response for both cyber and physical security events. 2020 will always be a first-of-a-kind year for all of us to live through this pandemic. Governments are reporting a quadruple increase in cyber crimes since March, and the attacks are mainly targeting the health sector. The virus is changing security and how we are dealing with technology. This is how we make decisions in our everyday life. And phishing is, as we see, phishing is #1 cause of breaches. Workplace violence is spiking, especially against medical staff at hospitals. And medical research has become the most valuable data for all of us. As we see the increase of telehealth adoption, which is a great tool for access and delivery of health services, it still comes with many implications on device security and privacy regulations. The mandate to encrypt sensitive data and authenticate users is more critical now than ever. Another emerging trend in healthcare that has started a few years ago is medical tourism, which is expected to continue to grow as people travel to seek less expensive options for their medical procedures. And it involves a wide cycle of stakeholders, with the patient or the medical tourist sits there in the middle, surrounded by physicians, brokers, marketing campaigns, insurance, and the travel industry. The most common procedure would typically be dental care, cosmetic surgery, elective procedures, and fertility treatment. And the table here highlights the huge difference in prices among countries for a heart bypass procedure, as an example. As we see, it's ranging from over $100,000 in the United States to only $3,000 in Mexico and $7,000 in Poland. So we should be vigilant to monitor the trends and associated risks of medical tourism, because we see big variations in the quality of clinical outcomes, which are heavily dependent on local practices, hygiene measures, and KPIs in each country. Also, the mobile patients can initiate endemic infections through the spread of cross-border pathogens. Accreditation measures are inconsistent among states, and our particular concern is for patient privacy and the flow of sensitive data across borders to ensure the continuity of care, which is not always possible due to privacy regulations such as GDPR, HIPAA, or the typical interoperability issues between different IT systems. So let's talk about what we can do, the industry, as a critical sector. The mission of the HISACs is to form trusted and resilient communities in the face of organized, sophisticated, and sometimes state-funded hackers and bad actors. This is why we need to stand together and protect our data. When you join H-ISAC, you will have over 4,000 analysts added to your team, working with you and for you, to help you build your strategy and share experiences and best practices when you need them. Our members are great companies to associate with. We have the top 50 global med device manufacturers, top pharma organizations, and largest public health systems in the entire world. And this is our membership mix this year. The largest portion is the health delivery organizations, which is the green part of the pie here, from small dental clinics to the largest multi-campus hospitals, followed by insurance companies, med device manufacturers, pharma, biotech companies, health IT organizations building apps and solutions for the industry. We also have R&D and university hospitals and large pharmacies. This is a picture of our SOC, the Security Operational Center of H-ISAC. We have dedicated staff of subject matter experts and security professionals who will work with you, your teams, to provide curated intelligence for your industry. We have a member-centric model. As you see in the data flow chart here, multiple sources of credible feeds from government agencies, regulatory bodies, law enforcement, and many global intel agencies. Our members collaborate and share what they see in their own environments and countries. And we have a wide network of security vendors and partners. All of this information gets shared with our members, and many use automated feeds to integrate with their own security SIMs for the forensic analysis. This is the benefits and the value of information that we share with our members every single day, focusing on both cyber and physical security, improved security posture, natural disasters, geopolitical landscape. We crowdsource cybersecurity expertise. And we talk about the guidance and the new regulations for medical devices with the largest regulatory authorities. We talk about the risks of emerging technologies. And the aim here is to build a community of trust and resilience as we share best practices. This is a few samples of the reports that we share with our members, the daily cyber headlines, cyber threat level. We use the traffic light protocol, physical security threat intelligence. We have a call that is widely attended by all of the members, the threat landscape briefing, and of course, we share physical security and legal and regulatory updates. We offer surveillance of the dark web, customized for your own domains, for the members, to detect any compromised credentials, their users, patients, or any sensitive medical data, counterfeited drugs or medical devices, or any underground criminal activities related to their organizations. CyWare is a mobile platform that provides access of all of these capabilities to our members to send real-time alerts of any crisis or cyber incidents in their organizations. These come to their well integrated with the smartphones, iPads, or laptops with great capabilities to filter and do customized settings. Shared Services is our digital marketplace where we partner with world-class security vendors to provide software, products, services, and tools to our members at very special rates. And we are very active. We have numerous committees, councils, and working groups that all the members contribute. They are proactive in joining and discussing all of the issues. We also are big on thought leadership, and we publish white papers, articles, blogs, and we welcome lots of collaboration with the industry members. We are also very active. We keep a busy calendar of workshops, working groups, white papers, and we have the annual summits. We have the European Council of Leadership Membership and Companies in Europe, and the Med Device Council. So with the membership, it comes equal seats at the table for all the members, no matter how the size of the organization. Everybody has the same licenses and the same access to all of the events. And let's watch a 1-minute video to summarize how H-ISAC can help. So with that, I thank you very much for your time today. Please feel free to reach out. I'm on LinkedIn, on Twitter, and please reach out to us. We can help. Thank you very much.